Many men believe testosterone declines because the body is malfunctioning. They assume something is broken, deficient, or failing with age. But in clinical reality, testosterone decline is often not a failure at all. It is a response, and in many cases, it is a protective one. Hormonal systems evolve to prioritize survival, not performance. Testosterone supports muscle growth, reproduction, risk-taking, and competitive behavior. All of those functions are useful, but none are essential in a threatening or unstable environment. When the body perceives sustained stress, uncertainty, or excessive load, it reallocates resources away from optional functions and toward preservation. Testosterone is one of the first variables adjusted. This is where modern confusion begins. Many men live in environments that continuously signal stress while appearing outwardly safe. Psychological pressure, financial responsibility, time scarcity, sleep disruption, metabolic strain, and chronic inflammation all send information to the nervous system. The body does not differentiate between ancient threats and modern ones. It only interprets signals. When those signals suggest instability, testosterone output is reduced deliberately. This reduction is often gradual. It happens quietly. Men rarely notice it at first. Energy dips slightly. Recovery takes longer. Motivation feels less consistent. Body composition changes subtly. Because the decline is slow, it is often attributed to aging or lifestyle rather than adaptation. But the system is doing exactly what it was designed to do. From a regulatory perspective, testosterone is not a goal. It is a tool. When conditions are favorable, the tool is deployed. When conditions are unfavorable, the tool is withdrawn. This is why testosterone decline frequently coincides with periods of high responsibility, prolonged stress, repeated dieting, overtraining, or chronic sleep debt. The body is responding to context, not malfunctioning. This also explains why forcing testosterone upward often produces disappointing results. When the system perceives threat, it adapts defensively. Binding proteins increase, conversion pathways shift, sensitivity changes, feedback mechanisms tighten. The number may rise temporarily, but the system resists sustained change because the underlying conditions have not improved. In this sense, testosterone decline can be viewed as a warning signal. It indicates that the system is operating near its limits. Ignoring that signal and pushing harder often worsens the situation. Energy declines further, motivation drops, recovery deteriorates. Men then conclude that they need more aggressive interventions, when in reality the system is asking for resolution of constraint. This protective response is especially evident in men who are highly disciplined. Consistency without flexibility can become a liability. Repeated stress without adequate recovery communicates risk to the system. Over time, hormonal output adapts to match what the body believes it can sustain. Testosterone declines not because effort is lacking, but because margin has disappeared. Understanding this reframes how testosterone should be interpreted. A decline does not automatically mean something needs to be fixed. It means something needs to be understood. The question is not how to restore testosterone at all costs. The question is why the system decided that higher testosterone was no longer appropriate. This perspective also explains why some men improve when they reduce intensity, rather than increase it. When stress signals decrease, recovery improves, and metabolic stability returns. The system becomes more permissive. Testosterone output can rise naturally because the environment feels safer. This change is often misunderstood as paradoxical, but it follows basic regulatory logic. It is important to clarify that this does not mean testosterone decline should always be ignored. Sometimes intervention is appropriate, but intervention without understanding context often leads to frustration. Treating the hormone without addressing the system rarely produces lasting improvement. The body will continue to prioritize stability over optimization. This is why many men feel worse when they chase hormonal performance without addressing stress, recovery, or metabolic health. The system interprets the mismatch as further threat. Protective mechanisms intensify. The very outcome men are trying to escape becomes more entrenched. A systems-based approach asks different questions. What signals is the body responding to? What constraints are present? What trade-offs are being made? Testosterone decline becomes meaningful information rather than an isolated problem. That information can guide decisions instead of provoking panic. This channel focuses on that interpretation. Not to normalize low testosterone and not to dismiss symptoms, but to explain why the body behaves the way it does. Because when testosterone declines, it is often the system communicating something important, and systems only change when the conditions that shape them change.